everyone, and welcome to The Balancing Act. I'm Olga Villaverdi.
And I'm Montel Williams. Today's show is all about health topics.
That's right, from the risk of gum disease
to cervical cancer, what women need to know.
Plus, financial solutions to help your credit.
Packed show, and it all begins right now.
That's right. Your smile says a lot about you in more ways than you might realize. Proper oral care is paramount for our overall health. And we're talking about more than just brushing our teeth. Gum disease is a significant health risk that affects nearly 65 million people. Wow! Today we're learning more about the signs, symptoms, and treatment options of gum disease, otherwise known as periodontitis, which is a chronic bacterial infection that cannot be cured and only managed. Joining us are doctors Hazel Glasper, a general dentist, and Brett Seelove, a cardiologist. Welcome to the show.
Thanks for having us.
Thanks. All right, so we have a lot to get to. Dr. Glasper, let me start with you. I mean, 65 million people, that's a lot of people. So why is it so important to know about this disease?
Well, it's important to, one, distinguish. There are different stages of gum disease. You have gingivitis that affects the gum tissue only, and it's reversible. So if you catch it early enough, it can be treated. Periodontitis, it's a chronic bacterial infection. It's an inflammatory response. It affects not only the gum tissue, but the bone. It is irreversible. It can go into remission, but it cannot be cured. So that's really important to know. It's also important to know that it's a silent disease. It could be asymptomatic. So you need to know the signs and symptoms, what to look for.
Let's go over them real quick if possible. What are they?
It's bleeding gums, bad breath, pain when chewing when it becomes more advanced, loose teeth that are sensitive, receding gums. So it's a lot.
So from a general dentist to a cardiologist, a lot of viewers must be thinking, why is a cardiologist there? But you are here for a reason, because there are health issues that occur, right, doctor?
Yeah, absolutely. The mouth is the entryway of bacteria and other things into the body. And we know that inflammation in the mouth can contribute to systemic inflammation in your body, which is overall a bad thing, from mental health to orthopedic health, but also cardiac health, heart health.
So once a diagnosis is made, what are some treatment options?
Scaling and root planing or deep cleaning, where you're removing the bacteria, the plaque, the calculus, and you can use various instruments to do that. But scaling and root planing is only 30% effective. Sometimes you have to use antibiotics. Locally applied antibiotics. You put them right into the infected pocket after it's been cleaned, and then you can eliminate any residual bacteria, and you can facilitate healing.
Dr. Seelove, why is it important to actively manage this infection?
The rheumatological arena, other inflammatory bowel diseases have been known for over a decade to cause systemic inflammation, which, as I said earlier, is not good for your overall body as well as your heart health. It's its own even heart risk. So what happens in the mouth and the inflammation in the mouth needs to be part of that dialogue. And the reason why this is so important, it should be additive to someone's risk when it comes to systemic inflammation, and it can't live alone anymore.
Dr. Glasper, your thoughts?
It's important to understand that periodontitis is an inflammatory condition. Patients come into our practice with diabetes, cardiovascular problems, autoimmune conditions. So we're seeing these same patients. Inflammation in the mouth is causing inflammation in the rest of the body. So the two of us working together and other dentists and physicians working together will improve the quality of our patients' lives.
And what kind of outcomes can patients expect?
Well, from my standpoint, I could tell you, from a medical standpoint, the number one outcome is just having this dialogue.
Yes.
Bridging the divide between the dental arena and the medical arena. That's the number one important part of this, that the patient needs to be the conduit to help bridge that divide. And they will be healthier just overall if the medical world can also, again, bridge into the dental world.
Dr. Glasper?
less inflammation, healthier patients.
That's right. So for our viewers who'd like more information, where can they go?
Orapharma.com.
Thank you both for your time and, of course, the information.
Thank
Pleasure.
you.
And if you'd like more information, just go to our website, thebalancingact.com. We'll be right back. Our current economy is affecting some harder than others. Many of us feel the impact every day when we're buying groceries, paying bills, or simply trying to get ahead. We know we need to maintain a good credit score, but when we're struggling to make ends meet, that's easier said than done. So the good news, today we have help from a leader at PREMIER Bankcard. Here with some great tips to help us manage this daily struggle is Suhey Sayer. Welcome.
Hi, thank you for having me.
Thanks for being here, because this is really an important topic. We mentioned the fact that people find themselves sometimes with more bills than their budget. So let's talk about that first.
Yeah, it's actually more common than you would think. A lot of people have to make difficult decisions every single day about balancing their financial obligations with the reality of not having a lot of funds. It can be kind of a difficult process to get out of it, but the number one thing is to be in communication with your lenders.
Great tips there. More common than ever. Don't feel bad about it. Balancing it all might mean tough decisions and no quick solutions. So for someone out there, for all those people out there saying, we owe a lot of money, not a great strategy to go radio silent.
That is correct.
Talk about that a little bit for me.
Yes, so they actually want you to be reaching out to them. They're able to provide solutions that will help you to manage your payment plans. For instance, at PREMIER, we have an award-winning 100% US-based customer service team that can help you find solutions just like that.
That's fantastic. So to sum that up, most important, communicate with your lenders. That is the key. Communicate. Some lenders may be willing to work with you and seek solutions to help manage payments. Now, we know that unfortunately life can be a vicious cycle. If you can't make ends meet, what would you say to someone that says, okay, I need to get out of this, but I don't want it to affect my score. I just don't want it to get worse.
Yeah, so I actually have 3 tips for you today that I want to share. The first one is to pay down your existing debt first. Try to get that as low as you can. The second one is to keep your balances manageable compared to your spending limits. And the third one is to stick to a budget to avoid overspending.
And I'm going to sum it up because you said it perfect. Pay down existing debt first, keep balances manageable, live within your means.
Yes.
How many times do we hear that, right?
All the time.
And at PREMIER, what I love the most is that you deal with customers with low credit scores every single day, right, Sui?
Yes, we do. I've worked there for almost 10 years, and I can say they're just built different than anybody else I've ever seen. Over the years, we've helped millions of customers take that second chance when other credit card companies passed on them. So whether you want to build your credit for the first time or rebuild it, PREMIER wants to help.
So if you want that second chance, it's right here. PREMIER has helped millions. Customer first focus. I love that. PREMIER approves lower credit scores. For our viewers who'd like more information, where can they go?
They can go to mypremiercreditcard.com or check out any of our social media pages.
And I think you're going to be helping a lot of people. Thank you so much.
Thank you.
And if you'd like more information, go to our website, thebalancingact.com. Ladies, I have a personal question for you. Do you know where your cervix is?
Yeah, it's a pretty personal question, but it turns out to be very relevant.
That's right, because if you don't know where your cervix is, chances are you also don't know your cervical cancer risk.
So today, we're going to help increase your awareness of what cervical cancer really is and decrease some of the stigma behind cervical cancer.
First, meet a courageous mother and survivor. Take a look.
Hi, my name is Marilis Clavisha, and I am 43 years old. I am an educator. I have a master's degree in education, and I did various roles through my working years. My partner and I live in New Hampshire. We have 4 kids together. I have a daughter from a prior marriage, and we have a son together, and I have 2 stepsons. And we are a non-traditional, blended, loving family.
But in 2019, Marilis received a shocking and devastating medical diagnosis.
In September 2019, I started feeling some symptoms that were not normal, and I talked to my primary care physician. I felt that there was something else going on and that I needed the second opinion. So I advocated for myself. Sometimes you have to do that and look for answers. And I did. I reached out to my gynecologist, oncologist, and they diagnosed me with metastatic cervical cancer. When I heard the news, the first thing that comes to your mind is, as a mother, is your children. And I said, I'm not gonna give up. I'm gonna win this game. I started treatment and things got worse. I was not responding to the treatment. The cancer was advancing and it moved to 4 or 5 parts of my body. And my prognosis was about 18 months. It was very emotional.
But incredibly, Marilis refused to give up hope. She and her partner, Dan, began a desperate search for clinical trials and eventually found Dr. Marilyn Huang.
I first met Marilis when she had just been diagnosed with recurrent metastatic cervical cancer, which is very devastating because most women who are diagnosed with this disease have approximately less than 2 years to live. And so they were as understandably quite desperate and had been looking for other options for treatment.
Advocates like Marilis and Dr. Huang believe sharing the facts about cervical cancer and cervical cancer prevention is very important.
Cervical cancer arises from normal cells on the cervix that have changes that develop over time, first into precancerous or dysplastic cells, and then eventually into cancer. For most women, they're able to clear those abnormal cells on their own, but unfortunately for some women, like Marilis, their immune system is not able to, and it does progress to cancer.
Since most cervical cancers are caused by persistent infection with human papillomavirus, or HPV, and because almost all HPV transmission happens through sexual contact, cervical cancer as a whole has suffered from long-standing stigma and misunderstanding.
HPV virus is readily transmissible from any skin-to-skin contact, and there is a lot of stigma and misconceptions surrounding HPV and HPV vaccination, which is really unwarranted since anyone who has had any sexual encounter could be exposed to HPV.
According to the Centers for Disease Control and Prevention, or CDC, the HPV vaccine is the standard for prevention of cancers caused by HPV.
The HPV vaccine is a vaccine that helps prevent cancer-causing infections in precancers, and it is incredibly effective. Currently, the HPV vaccine is recommended for both boys and girls as routine vaccination starting at the age of 11 to 12, although vaccination can start earlier. Vaccination is recommended for everyone through age 26. The vaccination is not recommended for everyone older than age 26. Some adults that are age 27 to 45 who have not already been vaccinated might be eligible to receive the HPV vaccine based on discussions with their doctor on risks and potential benefits.
According to cervical cancer experts like Dr. Huang, awareness of screening guidelines is also important.
So over the past few years, the screening guidelines for cervical cancer have changed based on the society or organization that are providing the recommendations. However, the American College of Gynecology endorses the following from the U.S. Preventative Services Task Force. All women aged 21 to 65 should have regular cervical cancer screenings, and recommendations differ based on age. Women 21 to 29 should have Pap tests every 3 years, and women 30 to 64 should have Pap tests and HPV tests every 5 years. For women that are older than 65, screening may not be required if all of their screenings previously were regularly performed and all results were normal.
Despite increasing awareness, the percentage of women in the United States who are overdue for their cervical cancer screening has been growing in recent years, which is why advocates like Dr. Huang and Marilis continue to speak out.
Hi, Marilis. How are you?
I'm good, Dr. Han. How are you? I think that women needs to be aware that this is a very deadly disease and that there is an option for a vaccination that they can take from a young age. We started our treatment. It was not easy. And after 6 months, I was on remission. I'm in remission since May 2020. I was flying for my treatment to a different state, and for me, being able to use telehealth and do some of my appointments online, it was a huge benefit. And it was very sad when I end the trial. I'm now kind of on my own, and I don't see Dr. Juan every 3 weeks, so I miss her. I miss seeing all my nurses and the staff. Since 2019, every year is a blessing, and I'm thankful for that. I thank God every day. I was able to see my daughter's engagement. I was able to be at her wedding and dance at her wedding all night long. I also saw my son confirmation, so it's been a blessing for me to being able to be here and be part of all of this.
Cervical cancer is a preventable disease, so it's really important to talk to your healthcare provider about your eligibility for the HPV vaccine, as well as the screening recommendations that would be right for you. The most rewarding part of my job is to get to spending some time with these amazing women, and they are true warriors.
We'd like to thank our two wonderful cervical cancer advocates, Marilis and Dr. Wong.
And for more information about cervical cancer screening and awareness, go to survivor.org. That's CERvivor.org, and the Foundation for Women's Cancer.org.
You can also go to our website, thebalancingact.com.
So ladies, do not forget to schedule your cervical cancer screening. We'll be back right after this. Thanks so much for joining us today.
And remember to head to our Facebook page, like us on Instagram, follow us on Twitter, and visit thebalancingact.com to enter our latest sweepstake or giveaway, as he's the conductor.
I always say, because you might just win something. Stay safe. Love that family of yours. We'll see you next time.